Out to the coronavirus, for South Carolina's daily coronavirus cases remain under 1,000 daily, but one upstate county is seeing a pretty big uptick. It's prompting local officials to meet later today. Here to talk with us about the state's pandemic is Dr. Jonathan Knoka from DHEC. Doctor, thanks for joining us early this morning.
Thank you for having me. Appreciate it.
Absolutely. Now, we do want to talk about the increased number of cases that we've seen in the upstate, mainly in Greenville County. And the question here is if you've been seeing anything, any sort of trends, or do you have any idea what might be behind the increase?
I think for Greenville County in particular, we've seen more testing going on in the area. So that, I think, over the last couple of weeks has contributed to what we're seeing in the Greenville County area. But if we look at the percent positive, the number of people that we test, if we were to test 100 people, about 15% of them have been positive, and that's been pretty consistent over the last couple of weeks.
And with that consistency, I imagine that's how you can actually trace how this is spreading. What does that number, the percent positive, tell you about the activity of the virus in the county, if it's going up or down?
Yes, that's one of the markers that we look at to give us another understanding of how much disease activity there is. So obviously, as you said already, the number of cases in Greenville County is going up, and that can be because you do more testing. So the way to help get a fuller picture of what's going on is to look at the percent of people that are positive. So if I take 100 people today and 100 people next week, and 10 are positive versus 15 are positive, that gives you a better perspective, or the percent positive gives you perspective of how much disease activity is going on in the community. So the level I would still say is high in Greenville County, but it's kind of been consistently at that 15 for the last couple of weeks.
All right, something very important to note for viewers at home so they know that the numbers really don't tell all. You kind of got to look past a few layers. Now, we do know with Halloween weekend coming up and Election Day on Tuesday, there's going to be a lot of movement around. Do you have any advice for folks that might be either trick-or-treating or heading out to vote on Tuesday?
Yeah, I think the important thing is to still follow the recommendations about keeping physical distance as much as you can, wearing your face mask. If there are sort of trick-or-treating activities going on, a costume mask really isn't sufficient. It has to still be a cloth mask. And if people can think of different ways to do some trick-or-treating in their distance, putting candy out and waiting their turn to go get candy, that'd be great. My family personally is going to do sort of a Easter egg hunt style trick-or-treats. So my kids are going to find candy going out. But I would still say when people go to vote, the same recommendations apply. You know, keep your distance from people in line and wear your face mask.
Yeah, great tips there for sure. We know with Halloween, we've seen a lot of those creative initiatives come about, which is also great to see. Now, we do know another concern was kind of the pandemic continuing along with the returning of this year's flu season. How have we seen in terms of flu activity? How is that looking?
Flu activity is looking pretty good right now, I would say. We've had 14 confirmed cases across the state, and that's very similar to the average number of cases at this time of year that we've seen during the past 5 years. So right now, the flu activity is where we expect it to be, but it's a good time to get vaccinated.
Absolutely, yeah. Urging folks to get out there and get the flu shot, especially with this year coinciding with the pandemic. Dr. Knoka of DHEC, we appreciate you being here with us this morning.